dealing with appearance anxiety. I will also say that here we are talking about milder forms of appearance anxiety. The severe forms are too severe; they need professional input. People who are like who are obsessing on their appearances day in and day out, who are contemplating going to surgeons. They are very severe cases who would take a very long time to recover. But simple principles of what can be done about it. Right. So one and the most important thing is obviously self-awareness. Self-awareness related to many things. First of all, I think the person needs to be self-aware and needs to come to this point that the problem is somewhere more than their body. So that's what they need, and it's very important. If you have someone like that with you, it's very important to not outrightly reject their concerns and say that, oh, you don't have a problem there, you have a problem in their head. That will simply alienate these people and they will feel that you don't understand them. So it's important to give this message very slowly, very politely and very empathically to them and say that, yes, I do understand, I can see that you are very disturbed by your body, but don't you think you have done enough to deal with it and it's still not doing? Maybe there could be something more than your body which is into play over it. So they would be more open to such kind of input rather than simply saying and dismissing their concerns, because no one likes their concerns to be outrightly rejected, ridiculed or dismissed. So that's very important. Apart from that, it's very important for the person to link these responses to trauma. If there has been any trauma in their life, whether that was sexual abuse, teasing, bullying, or they have, in general felt unloved. There are many people who may not have the trauma of that kind. They may be growing up in a very average, normal family, but they feel unloved due to different kinds of reasons. So it's very important to touch base with this trauma, with this intense feeling, that why do they, that what was wrong in their past, which makes them so unsure about their body. Finding the trauma and getting onto this trauma may not be so easy in everyone's case. In some cases it can be very easily discovered, in some it may not be so easily discovered, because there is also denial. People who have been traumatized use various forms of denial to deal with it, and one needs to work with it gradually. Then it's very important that once the trauma has been identified, and from the trauma one needs to make them get in touch with the view of their self. That because they were traumatized, they are feeling horrible about their self, they are feeling weak, they are feeling undesirable in their self, and then once they acknowledge these feelings about their self, then you could link them to their body. And that's how feelings are getting transferred from yourself to your body. And another component in self-awareness is that also questioning the view projected by media and the popular culture and understanding why you cannot resist it. So it's very important to understand this, because there may be hundreds of views prevalent. I may not want to agree with them, but I still agree with them. So it's very important to acknowledge this point, that why can you not resist a view? Or why do you buy into it without still wanting not to agree to it? So that's very important, because that would again lead you to certain weak points in yourself, as you were saying. So there's something wrong with yourself. That's why you are so highly impressionable. After that happens, a large work needs to be done on restoring the person's self-esteem, and making them feel good about their self. In that also, they would need to really recall, various traumatic experiences from their life, which are the sources of poor self-worth. And these may include, as I said, experiences of separation. In general, what happens is that as a child, if you have a very traumatic separation, even if things around you are fine, the children end up feeling that because I was left alone, or because this person died, or this person went away, or there was a divorce in my family, that had something to do with me. That's what children very naively start believing in. So various experiences of separation, rejection, bullying, abusing, difference is another very important thing. If you are born in a family where, say, your personality is very different from the rest of the personality, you inevitably would end up feeling very horrible about yourself if the family cannot find a way to celebrate this difference and create some space for it. If the family is such, that fine, it's a family of doctors, and here someone is born who's very rustic and who's very interested into athletics and stuff like that. If the family can open up to this difference and give space to it and value it to some extent, then things will be different. But if there's a lot of pressure on this person to come, along, so then this difference can again be very traumatic for the person. And the related fantasies about self, because with any kind of traumatic experience, you develop a view of yourself. So it's not important just to touch upon the traumatic experiences, but also to ask the person or make them reflect on that in relation to that trauma, how did they feel about themselves? That's very important to uncover. That how these experiences led to a distortion in the perception of the person's self and also in the perception of other people. Because generally when we are traumatized, we also start perceiving the world as a harsh place. So we feel that if I am not good, then I would be bashed by someone, or I would be hated by someone. Once these distortions are identified, they need to be challenged repeatedly. So the person needs to tell himself or herself that I feel so horrible about myself because of that thing which was there in the past, but there is no such thing in the present, and I am simply transferring those feelings onto here, and I need not be so bothered about this at this moment. And this is not something again which is very easy. It's like you have to get into a meditative trance, as you do in the meditation, that you chant the same thing again and again and again. So these kinds of self-understandings also have to be sort of gone past again and again in almost like a chant-like manner. Because once yourself is scarred, those feelings and thoughts will come up time and again, they need to be again and again dealt with. Challenging these distortions leads to a new set of experiences very gradually, which start enhancing a person's self-esteem. And ultimately getting in touch with your true self and allowing it to, giving it some kind of, space in various kind of activities and spheres would also help deal with this anxiety tremendously. Also, if the person has been traumatized, tolerance for feeling those feelings is very important, because until and unless the person is able to touch upon, if you can deal with those feelings only when you are able to feel them. So feeling them is very important. So the person needs to be in touch with their pain and face it. Also, sharing your emotions with people who understand you and who care for you very intimately is very important, and the person would undergo a whole mourning process which takes a lot of time. And then the last thing would be working with your thoughts, so that people who generally have very critical and perfectionist parts in themselves, so they need to time and again remind themselves that I am being too harsh on myself. It's not the way things are, or I need not be, I need not be a model or a film star to be loved by someone. So they need to do this kind of challenging their thoughts, and these